everyone. Welcome to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. Thank you so much for joining us today. As always, we want to give you some information to help you keep your pets healthy and happy for the duration of their life. And today we are going to talk about an organ called the liver. So we're going to talk all about the liver and liver disease that can occur in dogs and cats because, oftentimes we don't realize that many of the diseases that occur in humans can also occur in our pets. And so hopefully I can give you some information to help you keep your pets healthy. Now, in the meantime, I want to introduce you to our pet of the week. Our pet of the week is Lennon. Lennon is about a 4-month-old, male, neutered, black mouth cur mixed puppy. So Lennon has been with us for about 2 months, and he came to us just as a small little 8-week-old puppy who was abandoned in a crate. So we know that Lennon deserves to have a family who loves him and who's going to be there for him for his life. So if you're interested in meeting Lennon, please come on down and meet Lennon. He loves to curl up in laps and he loves to play, and he would make a great pet. So if you're interested in Lennon or adopting a pet, please come on down to our adoption center. We're open every day from 11 a.m. to 6 p.m. And we'd love for you to take a look at all of our pets available for adoption. So let's start talking about liver disease, and I'll just let you start with any questions that you might have.
All right, so does the function differ in humans, in pets, or does the same thing?
Right, so when we talk about the liver and the organ itself, what does it do for us? What does it do for your pets? And it has lots of very important functions. So one of the main things that people tend to associate the liver with is metabolism. So the liver will metabolize medications, nutrients, and all kinds of things that we take into our body. So the liver is very, very important in metabolism and breaking down of substances. The liver also is very important in helping to filter the blood. So when the blood comes from places in the abdomen, like the spleen and the intestine and the pancreas, that blood gets filtered through the liver, and the liver is responsible for removing a lot of those toxins. So the liver is important for removing toxins from the blood, metabolizing nutrients. The liver is very important in making clotting factors. So when you think about your blood clotting, let's say you cut yourself and you begin to bleed, and then your blood starts to clot, we want that to happen. Well, one of the organs that helps that to occur is the liver. So the liver has lots of very important functions, and we want to make sure it stays healthy.
So when a dog has liver disease, what are those effects?
Right. So the liver can become diseased, and there's lots of different ways that the liver can be affected. In general, there are 2 types of liver disease classifications. So we can classify liver disease as what we call primary. Primary liver diseases are those that originate in the liver. There's something going on in the liver tissue itself. It originated there, and we call that primary liver disease. There's also secondary liver disease. Secondary liver disease tends to occur secondary to some other cause. So maybe another disease process, that is secondary liver disease. And so there's lots of different types, but certainly the disease can be serious in both dogs and cats, and it can affect your pet in multiple different ways.
And so what are the causes of liver disease, both, I guess, primary and secondary?
Right. So, some causes, one of the most common causes can sometimes just be old age. It can sometimes just be as your pet ages. Sometimes organs begin to malfunction, and it could just be a primary liver disease just because your pet has aged. There are other things though. For example, viruses. A common virus that can affect the liver is leptospirosis. Different types of bacteria can also cause liver disease, can cause a hepatitis or an inflammation of the liver. There are also drugs that can cause liver disease. And that's because, as I mentioned, the liver is responsible for metabolizing drugs and clearing toxins out of the blood. So if the liver becomes overwhelmed by certain drugs and toxins, that also can cause liver disease. So things like non-steroidal anti-inflammatory drugs can cause liver disease. Sometimes over-the-counter medications like acetaminophen can cause liver disease. So you want to be careful about those things. Acetaminophen, ibuprofen, plants. There are certain plants that can cause liver disease, like sago palm. So there can be lots of things that can cause liver disease. And so it's important that if you notice symptoms, which we'll talk about in a minute, that you get your pet to the veterinarian.
And what are the symptoms if a dog is going through this disease?
Right. So I wish there was something really specific that I could tell you, like, if you notice this in your pet, it could be liver disease. But I will say sometimes the symptoms are very general. So it could be that your pet is just not feeling well. They're lethargic. They're not eating. Sometimes it might mean that they're vomiting. One sign that the liver could be affected that's pretty specific for the liver, and that is jaundice. Or that is when you look at your pet and if you observe the white part of the eyes, or if you observe the paws or the inside of the ears, or the mucous membrane color of the mouth, if that appears to be yellow as opposed to pink or pale, then that could indicate liver disease. So we call that jaundice or icterus, where the mucous membranes, the skin can turn a yellow color. Liver disease is not the only thing that causes that. There are some blood diseases that cause jaundice, but if we see that in our pets, that's one of the clues that liver disease could be on the list for causes.
And so because the symptoms can vary so much and kind of broad, how is it diagnosed?
So it's important that you take your pet to the veterinarian every year to get yearly annual blood work. Just have a blood panel done so that your veterinarian has a good idea about the function of your pet's organs. That blood work will not only check the liver, but will usually check other things as well, the health of the kidneys, health of the pancreas, and check any blood levels and white blood cell levels. So one way is just to make sure that we are doing regular checkups of the health of the organ. And then when you get that blood work done, if there's any change in what we call the liver enzymes, those enzymes on the blood work that are specific to the liver, your veterinarian will notice that. So typically we diagnose liver disease with a blood profile. And what we'll see is that enzymes that are specific to the liver, that tend to live in the liver tissue, those may be elevated, and that gives us a clue that there's something going on in that liver tissue that we need to investigate further.
And are there any dogs or breeds that are more predisposed to the liver disease?
It certainly depends. Any breed can get liver disease, particularly, if it's caused by a toxin or old age. There are some specific types of liver disease, for example, copper storage disease, that can be more common in certain breeds. If you have a purebred dog, Bedlington Terriers or Doberman Pinschers, some of these dogs may have, Dalmatians may have a more likelihood of getting liver disease, but it can happen in any breed of dog.
Okay, and then once confirmed, what are the treatment options?
Right, so let's say your veterinarian has diagnosed your pet with liver disease. It's important that we know the cause, because the cause is going to help us direct our treatment. So, for example, if it's old age and maybe we can't find, a specific cause, but we think, it's just because your pet is getting older, something that we'll do is just put your pet on liver protectants, medications that help to protect the liver tissue that's there, the liver tissue that's healthy, so that it can continue to do its job. But if we find that there's a particular bacteria or virus or toxin that we can target our treatment, then we will do that. For example, if we know that it's leptospirosis, a type of bacteria, we can give an antibiotic that will kill that bacteria, and we can begin to heal the liver. If we know that it's some other type of toxin that your pet got into, we can make sure that we do decontamination processes to get that toxin out of the bloodstream and hopefully continue to protect the liver. So cause is very important, and the treatments are going to vary based on the cause.
If the cause is just old age, what is the prognosis, or how long should we expect our pet to be with us?
Yeah, that's a great question, and unfortunately it's a hard question to answer. The liver is pretty resilient, and we can lose, and our pets can lose a significant part of liver function and still have a fairly good quality of life. But it's hard to tell, because It depends on how far along that liver disease is and how much functioning liver that we have. And so if your veterinarian is able to catch the liver disease early, putting your pet on liver protectant medications can allow them to live many years, several years after that diagnosis. Unfortunately, sometimes the most severe liver diseases are the ones that occur acutely, meaning very quick, like a toxicity, because typically what happens is there's so much damage done to the liver at one time that we don't have enough time to have the medications work. And so if we can catch it early, we can usually, keep the process from progressing extensively. If it's a toxin or an injury or acute disease, sometimes the prognosis is a little more poor.
Is there anything we can do to prevent it, or just,
Yeah, you want to make
keep
sure
in mind
that you keep your pets healthy. Take your pets to the veterinarian every year. Get vaccinated. There is a vaccine against canine adenovirus 1, which is hepatitis. It's a type of virus that can cause hepatitis. When you're getting your pet's distemper vaccine, it's actually included in there. So the A in the distemper vaccine, the DAPP, that will protect against adenoviruses. And adenovirus 1 is one of the viruses that causes hepatitis. So making sure your pets are current on their vaccines, seeing their veterinarian once a year for that annual blood work so that we can catch disease early, and then keeping them out of toxins. So don't give your pets any over-the-counter medications. Give all medications as prescribed, and try not to have things around your home that may be toxic to dogs. For example, the sago palm is a plant that is very common, but can definitely cause liver and kidney failure. So those are the things that you can do to just kind of be aware of keeping your pet's liver healthy.
All right, I think that's all the questions we have. Where if people want to come and visit us, where can they come?
Thank you guys so much for tuning in again. Please come on down and visit us at our adoption center every day from 11 a.m. to 6 p.m. We would love to help you find a pet that's going to fit with your lifestyle. And so if you'd like to become a part of our extended family, I also invite you to go to HoustonSPCA.org and look at ways to give. We would love to have you as a foster parent. That helps us to save so many lives. We'd love to have you as volunteers. We couldn't do what we do if we did not have the volunteers every day helping us to walk dogs, enrich the cats, and just spend time with us and the animals here. We're forever grateful for them. And then there's also ways that you can donate financially, because we also really appreciate our financial donors as well. Thank you guys so much for being a part of our weekly podcast and joining us every week. And hopefully we will see you soon.